tube and the night feedings.
Yeah, and you just didn't know if it would even be an option.
Yes, exactly. Yeah.
And then you said when he was younger, it might have been nice to have some more therapies at home. Could you talk more about what specific therapies you had and maybe which ones you wish you could have had?
Yeah, so the actual therapies that we had were all good. It was more the logistics around it that made it hard. So because it was not in the home, but it was in different clinics. So the occupational therapy, the physical therapy, his vision therapy, speech, they were all in different locations. And if you have two full-time working parents, trying to work that in their regular schedule is really hard.
Yeah, definitely. You talked about how he had someone come to the home, the neurodevelopmental specialist. Is that true? So you had that one in-home therapy, but then all of your other therapies you were still getting outside of the home. Okay.
Exactly.
All right. And do you know, so you mentioned you didn't have a home nurse, and then you didn't have in-home therapy for your other therapies. Do you know why you didn't get that home health care?
You mean the therapies in the home?
Mm-hmm.
I don't think that's provided at all. There's no option for it.
Okay. So in your area, you're not aware of it if it's available.
Right. Yeah. They only offer it in the clinic, as far as I know.
Okay. Can you please tell us about a time when your child did not receive the home health care services that they were intended to, or the care did not go exactly as planned?
I don't. So in the cases where we were with the physical therapies that we and the OT and the speech that we would have liked at home, that clearly didn't happen, but they weren't intended to. So that might be a different case.
Okay.
But other than that, everything that we did get in home went according to planning.
Okay, sounds good. And then could you think about the times when your child received the home health care that they were intended to and the process went well? What factors do you think might help to facilitate the smooth process?
So a big thing is the communication between the doctors and the actual service providers. If those happen quickly, and the service provider is a good communicator as well with the parents, that really helps facilitating things. So communication is, I think, really a big contributor here.
Okay. How does where you live influence your options for home health care, if at all, either currently or in the past?
I feel like because I work in a hospital and live fairly close to a hospital, we've been lucky having a lot of options available fairly closely. I know from the therapist that it's very different when you don't live in an urban area close to a hospital. So I think it has, in our case, has had a positive impact.
Okay. How have options for home health care been influenced by your child's insurance status, if at all?
So this is actually something. I'm trying to think how to answer it. So far, we've been able to receive a lot of the home health care that we needed. For the developmental therapist, that was actually not provided by insurance, but by the state or by the national metro. So that's something that's not determined by insurance. So maybe it hasn't had too much influence. Maybe the nurse, if we would have looked after it, that may have determined whether we would have been eligible for it.
Okay. So when you're talking about, could you talk a little bit more about what you mean when you say we were talking about the stuff provided by the state? Is that, what type of therapy is that?
Oh, sorry, yes, I should have been more clear. That was the developmental therapy.
Oh, that
in the home.
Developmental therapy was provided by the state. Okay.
Yeah, or that's a Tennessee early intervention service,
yep.
And that also covers part of other therapies through insurance. So it does help a lot too with other therapies, but they were all outside of the home.
Okay, so the early intervention services kind of covered them coming to your home, and then maybe helped with the costs associated with like the PT, OT, and stuff like that outside of the home. Is that correct?
Correctly, yes,
Okay.
correct.
And then now it sounded like you mentioned, was it your employer? Is that through your employer's insurance that you get, that you now receive those therapies?
Yes, but the coverage is limited.
It's all covered through the insurance then?
Yeah, it's not fully covered, but yes, that's our first resource, yes.
Okay. Could you talk a little bit more about any financial costs to your family that are associated with home health care specifically?
So we didn't have to for the developmental therapy. We didn't have any extra expenses, and for the G2, most of it has been covered. But that has been a little bit of a search process. So trying to find the right nutrition for our child that was covered by insurance was initially difficult. So we've been through phases where his feeding was not covered, and it was not as it wasn't like a normal meal that you would pay for your child. It was very more expensive. So we did have extra expenses for trying to find the right G-tube feeding.
Okay. If you have any questions or concern about your child's home health care, who do you turn to for help?
Usually, it depends on what's going on, but either the provider directly or his medical doctor, pediatrician.
And what does it kind of look like when if you were to turn to them? Do you call them, or how do you get a hold of them, and what do those conversations look like?
Yeah, for example, if you would have an issue with the pump or we need new supplies, I usually email the provider, and then they can say what they can do for us or how they can help. And if it doesn't get solved, or if it's an insurance issue, then I would contact our pediatrician or the case manager of the pediatrician, and they can help us out.
Okay. In general, what do you wish that clinicians who prescribe home health care could do differently, if anything?
Yeah. I guess providing the widest range of options for parents, but I know this is really difficult because each child is unique, and you're in a learning process of what the child needs, especially when it has complex needs. But that will be most helpful is in the information for the parents.
Okay. Yeah, it sounded like before you didn't even know that home nursing might have been a possibility.
Yeah, and that's it. And the same for like his vision therapies or maybe his feeding. Those are all kinds of things that you don't know initially what you're going to need, or the child might not need it immediately. But you want to be aware of the options so you can jump in at the right time when it's actually necessary.
Mm-hmm. What about home health care agencies and providers? What do you wish that they could do differently?
That I'm not sure about. We are happy with our provider, and that's mostly because they're accessible, they're easy to get in touch with, and they provide quickly.
Okay. What do you wish insurance companies and policymakers could do differently regarding home health care for children with complex conditions?
Yeah, be more flexible. This is really tricky because obviously every parent wants to have everything covered, and I know that doesn't work like that. But really individualized to kids with special needs, that would be very helpful. And I know this is really difficult with insurance. Mm-hmm. It seems like you need to fulfill so many criteria before you're eligible for something that child has to be dying before you get certain services. So that is really tricky, and I know that it just works like that. But yeah.
Okay. Are you aware of any local, state, or national policies that impact home health care for infants and children?
No, I'm not aware of this, of how that's, actually, no, I'm sorry, no, that would all be going through Vanderbilt as the service from university here.
Okay, but that sounds, so your employer has services that are available.
Yeah, they do have some services that I'm aware of. I don't know exactly like what the policies are, but I do know that they have services.
Okay. And is that just for employees, or is that kind of through the hospital for all the kiddos?
I think it is for everybody who's within the Vanderbilt network.
Okay.
Yes.
So everyone who's kind of seen there.
Mm-hmm.
Okay. And then just the last question, is there anything else that you'd like to tell us about home health care that we haven't asked you about?
No, I think we've covered most of it.
Okay, awesome.
Yeah.
All right, so I'm just going to turn off the recorder then.